In the hospital, we're worried a lot about infection spreading to other patients. So when you've got a patient with something like MRSA, VRE, or even something as simple as the flu, you've got to make sure that you're the person that stops the infection from spreading to other people. The main thing is wash your hands. Don't be gross. Just wash your hands before and after you leave a patient's room, because that's the most important thing. It might take up some time, but as soon as you make it a habit, it's not going to be that hard to do anymore. So after you have an infectious disease, you have to have a reservoir. So some things that you need to do in order to avoid allowing a reservoir to keep an infection on it is keep dressings dry and intact. Make sure that you clean areas that are moist and dark, like under a pannus on a patient who's obese. You need to make sure that you keep your patient's room clean. Lots of times you've got those hoarders that like to hold all of their stuff in. Make sure that you wipe off their table, keep things clean. Don't allow dirty animals or anything into your patient's room. Especially in patients' rooms who they have established them as neutropenic precautions, you need to make sure that you remove flowers and fresh fruit. That is an increased chance of allowing bacteria into your patient's room, which is dangerous for allowing a reservoir. Next, after your reservoir, you've got a portal of exit. So you need to have some way for that bacteria to come out of your patient's body and be able to be transferred to someone else. So that's some things that can help transfer are things like sneezing, coughing. Make sure that you keep your patient's cuts covered. If they're oozing, then you need to make sure that those are covered or that they've got a drainage system. Make sure that you're following ordered precautions and you're wearing gloves when you're doing procedures. Next, you've got a mode of transmission. As soon as that portal of exit allows bacteria onto you or onto one of their family members, that increases the risk of your patient spreading a disease to your other patients. So what you need to do for that is make sure that you change your gloves. Of course, wash your hands in between patients. That's the most important. But change your gloves. Don't do one gross procedure and then go to the next, even if it's on the same patient. You need to change your gloves. Make sure that you're following ordered precautions. When a doctor orders a precaution like airborne precautions, don't think that you're an exception to the rule by not wearing a mask. Make sure that you do everything that you're supposed to do for it. Next, you've got a portal of entry. As soon as that bacteria is onto you and you take it to another patient, your patient has to have some way that it can get into them. So like a cut or a mucous membrane. So some things that you need to do is you need to make sure that you are always wearing gloves. You need to use aseptic techniques when you're changing dressings and lines. You need to be aware of mucous membranes. Make sure that you're not touching anything wet or sticky that isn't yours without gloves on. Next, you've got a susceptible host, which is basically any patient in the hospital. They are all usually immunocompromised, and so you need to make sure that you know your patient, especially diabetics, patients with AIDS, HIV, patients with asthma or COPD are all immunosuppressed. Especially patients who are NPO, they can become malnourished, and that just increases the risk of being susceptible to any disease. Certain medications can also decrease your immune system, such as chemotherapy, so you need to make sure that you're following all of the precautions that you need to. The biggest thing with this is making sure that you're teaching others also. When patients have family come in, lots of times they don't obey precautions. Make sure that you put a sign on the door that says, "See the nurse before you come into the room," and ensure that they understand why those precautions are in place. It's important for them to know, because if they aren't following the precautions, then we have an increased risk of them spreading the disease to other people. So it might not be our fault, but inadvertently it kind of is, because we didn't teach them what they're supposed to be doing.